From the corridors of justice to health matters now, where officers from the Ministry of Health are scheduled to meet with the acting U.S. ambassador to Kenya, Mark Dillard, on Wednesday in a bid to persuade the U.S. government to reinstate its foreign aid to Kenya.
The funding freeze has significantly affected various health programs in the country.
The Health Cabinet Secretary, Dr. Deborah Barasa, revealed that the withdrawal of U.S. funds has created a 30.9 billion shilling budget shortfall, which could lead to over 50,000 new HIV infections by 2030 and at least 23,000 TB-related deaths annually if alternative funding is not secured.
Gloria Milimu with more.
In a move aimed at suturing the gaping finance wound left by the U.S. government fund freeze in the country, the government is now set to engage the diplomatic gear in an attempt to mitigate the impact of the freeze on the country's health outcomes.
We are engaging diplomatic interventions. On Wednesday, we'll be meeting the U.S. acting ambassador, and we are also developing an impact assessment of which we will be sharing with the various development matters and diplomatic for interventions.
According to the health boss, Kenya stares at a 30.9 billion shillings finance gap that threatens to reverse gains made through former health US-funded programs in the country. Without restoring this funding, HIV infections could rise to 58,495 by 2030, while tuberculosis could claim at least 23,500 lives annually.
For TB, we are likely to have 23,500 TB annual mortalities, among them being 20,000 people living with HIV. And for malaria, we're likely to have 12,000 deaths per year, with projected increase because of climate change.
The loss of funding for HIV commodities can be estimated to be around 13.5 billion shillings annually. To address this, we must take decisive action to integrate donor-supported systems into our health system and ensure sustainability.
The funding cuts have also jeopardized family planning programs currently covering 77% of the population, leaving 6.2 million people without access to essential services. Other critical programs facing funding challenges include blood transfusion services, whose 2.8 billion shillings World Bank project is set to end in March. Also affected are immunization, vaccines, family planning and nutrition programs requiring 11.6 billion, 2.4 billion and 4.6 billion shillings respectively.
Our objective as government is to make sure that no decision that is made by our development partners affects the quality of healthcare we provide to the people of Kenya.
The U.S. funding freeze has put Kenya's health sector in jeopardy. And as the government seeks alternative financing options, experts advise that sustainability must be at the core of these mitigation measures. Gloria Milimu, KTN, Nairobi.
Well, grim reality there in terms